We're going to continue our discussion about cancer, discussing the care of patients with cancer from your 8th edition of IGGY, Chapter 22. Why should we even treat cancer? Essentially, what we're trying to do is prolong survival time and increase quality of life. Without treatment, many people would not survive long after they've been diagnosed with cancer, especially metastatic cancer that is affecting organs and other aspects of people's lives. Some general disease-related consequences of cancer. We've discussed this multiple times, but reduced immune and blood-producing function. Most often we're going to see this in leukemia, but we can also see it in any kind of cancer that invades the bone marrow. So because these cancers suppress the bone marrow and bone marrow cells, we're causing that immunosuppression, anemia, thrombocytopenia, and which is decreased platelets. When this happens to people, they might get weak, short of breath, fatigued. Of course, we're going to have an increased risk of bleeding with the thrombocytopenia. Some patients with cancer can have altered GI structure and function. This might be because GI tumors that are in the GI tract can actually decrease absorption. They can compress the soft GI tissues, and that could actually cause obstruction as well. Motor and sensory deficits. These can occur when the cancer is in the bone or the brain. It compresses nerves. Cancer treatments can also have negative effects on these symptoms, and we have to consider that pain might be a reason that people have motor and sensory deficits when they're dealing with sequelae of cancer. Decreased respiratory function is also a potential consequence of cancer. This can be due to tumors in the airway or vessels being compressed in the chest, which could cause pulmonary edema. Let's discuss surgery as cancer treatment. Surgery is the oldest form of cancer treatment, and there are multiple reasons that people would have surgery for cancer treatment. Surgery for cancer is the removal of diseased or even suspicious tissue. We use this for diagnosis as well as treatment. So the nice part about surgery for cancer treatment is if the cancer was confined to the tissue that was removed, we've essentially cured the cancer. This, of course, doesn't always happen. So that's one of the reasons that we would perform surgery as a treatment for cancer, is actually curative. Prophylaxis is going to be when we remove the tissue that's at risk to prevent cancer development. So, for instance, when we know someone has a premalignant condition or a strong predisposition for cancer development, we might remove that piece of tissue. For example, we might take out a colon polyp before it actually becomes cancerous. Diagnosis is another reason that we would use surgery. So we would take a biopsy, remove part or all of the lesion, and then examine it and test it. This can come in a lot of different forms. It could be as minimal as fine needle aspiration, or we could have a full open exploratory surgery. We already kind of discussed curative surgery, but this is when we remove all cancer tissue. And surgery alone can result in a cure rate of 30% when all visible and microscopic tumor pieces are removed. We might use surgery as control or cryoreductive surgery. This is going to remove part of a tumor, but not all of it. This is what we would consider debulking, or just making the tumor smaller. So it decreases the tumor size, and this might be, as we'll discuss in the next aspect, it might be palliative, but it also could be an opportunity to give other therapies a better chance, like radiation or chemo. It might give them a better opportunity to treat the cancer if we take out some of the tumor. Palliative surgery for cancer treatment is just going to be focusing on improving the quality of life, usually just decreasing pain or decreasing an obstruction, difficulty swallowing, difficulty breathing, difficulty moving. These things are, if we're just trying to enhance someone's quality of life, not attempting to cure, but knowing that if we remove the volume of some of this tumor, it's going to make things easier on them. We might use surgery to assess therapy effectiveness. Sometimes they call this second look surgery. It's like we're repeating an exam after treatment. So they might do this to determine if therapy was successful, if therapy should be continued, or if therapy should be stopped. And the last kind of surgery as cancer treatment is reconstructive. So this is when we're going to increase function or potentially enhance appearance. An example of this would be breast reconstruction after mastectomy. Some side effects of surgical therapy: loss of body part or function. Oftentimes when we perform surgery as a treatment, we're going to be losing part of a body or an entire body part. This could also mean losing the function of that body part, even if we don't lose the entire body part. So if the surgery was somewhere near someone's genitals, we might be talking about sexual changes, which could be a huge aspect of someone's life. So loss of body part or function, they might need physical therapy, speech therapy. If for speech therapy, for example, if they need help swallowing or actually help learning how to speak again because the surgery is on the head or the neck or the throat or the tongue. Occupational therapy might be needed if we lose part of a hand or an arm. Physical therapy would be needed for both of those situations as well. Scarring is a very common side effect of surgical therapy, and then disfigurement. So while most people are happy to be rid of the cancer, we have to respect and appreciate the fact that they might also be mourning their former appearance or lifestyle. Let's say they are very physically active and suddenly they lose a limb for cancer treatment. Well, that is they need time to mourn and grieve their former lifestyle. We're going to continue on in the next lectures talking about radiation and chemotherapy and other treatments for cancer.